All right. Welcome to Ask Dr. Jason. It's a beautiful sunny day in LA. It's Friday. I'm blessed to be here with you. I've got my amazing team with me. We've got some questions. We have had questions piling in. If you're here, share the stream. Come on in. We're going to answer your questions. We're going to take Instagram questions. We're going to take shout outs. We're going to take Facebook questions and shout outs. Come on, let's do this. Bridget, let's roll.
All right, first question comes from India.
Okay.
Hopefully I am saying this name correctly. It's Kuljit from India.
Okay.
His neck is stuck from the right side and wants to know what kind of medicine he can take and exercise.
Oh, $1 million question. What type of medicine will correct a spinal misalignment? There is none. So what you do is you receive a chiropractic checkup, and then you receive a specific scientific chiropractic adjustment to realign the spine. And exercises, woo! We got a show, active health tips. We go over exercises for you. So Kuljit, thank you for watching wherever you are, India. All right, and we'll get you next time. Go see a chiro. Next question, please.
Okay, Abby Des says, hey Dr. Jason, I'm only 18.
Hey Abby.
And I believe I have hyperkyphosis.
Okay, so hold on. Hyperkyphosis is when your mid-back, people usually referring to, it can be anywhere in the spine, it's usually that. Okay, so she's slouching. Go ahead.
Okay. It's more of a personal thing due to breast size, but would chiropractic care help to reverse the kyphosis at all? I know I also have to strengthen my back, but would the chiropractic care at least help?
Yes, the answer, Abby, is yes. Chiropractic care helps to realign the spine, retrain the brain to hold the spine more erect, and then sometimes, only a couple times in 14 years, I've actually had 2 women that I sent for a breast reduction because it was causing them so much pain and chronic subluxation. Most women, though, we can adjust the spine to align it, strengthen with exercises, and they do amazing. Great question. Thank you, Abby, for watching. Next question, please.
Wealthy Massage Man asks, how do I lose the fear of crack?
All right, Wealthy Massage Man, here we go. Number 1, if you're afraid of crack, you shouldn't be doing drugs anyways. Okay, crack is a dangerous drug. It's not a good drug. Oh, wait a minute. Were you talking about the adjustment? Wealthy Massage Man, if you're really wealthy, I would think you would know that we call it an alignment or an adjustment, not a crack. You may be referring to the noise that you hear, which is what we call a cavitation or a release of nitrogen gas from the joint. If you're afraid of getting an adjustment, you're probably really tight, you're probably really out of alignment, and having said that, you probably need to go to a chiro and start off gentle. That'll help you get rid of the fear of the cavitation. Thank you. Next question.
Dog Pound Rocks 58 says, hey Dr. Jason.
Come on.
I love what you do, and I was wondering what might be the cause of my neck and lower back pain.
Okay. Awesome. So Dog Pound Rocks, thank you for watching. Appreciate the attention. Usual causes, there are many causes of neck pain and back pain. Usual causes are vertebrae out of alignment called subluxations that then get stuck, put pressure on the nerves, cause abnormal muscle contraction, and as a result, you can experience pain, discomfort, limited range of motion, and possible other function because of where those nerves go to. Definitely want to get to a chiro. Thank you for watching. Next question.
Elme is in the UK.
Come on.
She says, what does it mean when your hand goes numb?
Oh, LMA, is it?
Mm-hmm.
LMA from the UK. Hello, love. Yeah, they love my British accent, my team here. Come on. All right. So thank you for watching wherever you are. Now, if your hand goes numb, there can be different reasons. Usually the cause is a pressure on a nerve from a subluxation, a spinal misalignment in the lower neck, upper back vertebrae there, upper thoracic. It can sometimes be distal and entrapment in the shoulder, the elbow, the wrist. Usually it's not. Usually it's from the neck. I know a lot of great chiros in the UK. Definitely send me a message, a DM, an email, whatever, and I'll get you connected with one of them. Great question. Thank you. Next question, Bridge.
Okay, Suma says, could I have your opinion about my mom's back? She fell down at home and one piece of spine is smashed. Doctors here are saying it needs surgery. Can it be healed without surgery?
Okay, so that's a great question. Mad love and respect to your mother. First of all, I cannot diagnose or give you a prognosis how it's going to go over Instagram or over social media. What I can do is tell you that chances are, if you get her to a chiropractor, we may be able to help her avoid surgery. Now remember, I haven't seen any x-ray, MRI, anything. I'm not her doctor. I've just helped a lot of people avoid serious problems. Now, having said that, there is a time and a place for surgery. There's a time and a place where you don't want to see a chiropractor, but they are few and far between. We can actually help most spinal conditions. So definitely get her for an analysis to a chiropractor. If she comes into me and it's not a chiropractic case, I'll send her right away to the surgeon. Great question, thank you.
All right, next question comes from Fiji.
Fiji!
From CO.
Come on, CO. All right, let's go.
All right, he's been watching most of our videos. And
okay, wait. He's been watching most? A CO. We're putting out content for you, brother. Come on, man. Okay, thank you for watching most of them. Let's get on all of them. Let's go.
All right, he says his lower back and right shoulder needs fixing from playing rugby. It's been bothering him for 7 years now. His question is, who should I go and see to fix me up at the hospital?
Okay, well, first of all, I don't know if I would go to the hospital, because that's for sick people, and we don't want to necessarily go there for lower back and shoulder pain. Again, a lot of these questions, you see the same theme running through it, but they're good questions. They're very good questions, and I appreciate you asking. You really want to go to a chiropractor and get checked out, because if your spine is aligned, the body can heal in most cases. All right, so go to the chiro, get checked out, and if I'm ever out in Fiji, come on, let's roll. Next question.
Okay, J. Crazo 62.
All right.
Says, hi, Dr. Jason. I've been following you for a little bit and seeing the things you can do to help people with back and spinal problems.
Thank you.
I have a problem that's causing a pinched nerve. They say I have to have surgery. Do I have to, or can it be fixed with what you can do?
Excellent. Let me see that one, because I wonder if it's the gentleman that... Okay, I remember this gentleman, and we furthered the conversation. He actually sent me some images of his spine, and what we said to J. Crazo 62 is that in his case, it does actually appear to be a surgical case. So as much as I would love to help him, there's a possibility, there's a chance that I could help him, but Jay, I think you waited too long, as I said on my message there. I think you really waited too long. The arthritis degeneration is severe. It's what's called a spondylolisthesis. It's slid forward. The vertebrae has slid forward. It's putting direct pressure on the spinal cord. You could try a conservative bout of chiropractic care with me or someone else. With a case like yours, I'd go 2 weeks, and then I would already know within 2 weeks whether or not we could help you. So, guys, this is a big message for people, is that if you wait too long for your teeth, you just pay more, and then you can get them fixed. You wait too long with your spine, oh my God, it can be impossible to heal. So great question, thank you, great one.
All right, next question.
Yeah.
Darshan.
Who?
94. Darshan?
Darshan, okay, cool, let's roll.
94 says, I have grade 1 spondylolisthesis.
There you go, another person with a spondy, yep, let's do it.
How can I cure this? Please help me.
Okay, now a spondylolisthesis is where the vertebrae slides forward. Grade 1 means it slid forward a little bit. I've had patients and helped them where we adjust above and below, and we've actually seen that spondy go back into alignment. This does not happen on every person. What we do is a recipe of, first of all, examination, x-ray procedure, and then specific chiropractic care combined with core strengthening exercises to keep it in alignment, and sometimes extensive muscle rehab. So you've got to get to a qualified chiro. You've got to get to a good chiro. That condition can get worse and it can be painful. Thank you. Next question.
Okay, next question is from a Miss.
Okay.
She says,
all right.
I've been under constant stress and I've had a problem losing weight.
Okay.
Look, I know you're not a dietitian,
Correct.
but you talk about exercising healthy life.
Yes.
How to lose weight after trauma. I have gained 15 kilograms in a very short time and struggling with focus.
Ouch. All right, so what Miss is talking about here is that her weight really is a symptom. So her weight is not really the problem, although you're like, hey, I gotta lose some weight. The weight is the symptom. She's having issues dealing with stress. She's having issues focusing. Number one, alignment. Alignment is everything. It's very, very, very important. But number two, you've got to look at what we call the dream, and you've probably seen this on some of my other talks. Your diet, your rest, your exercise. A is for alignment, and M is your mindset. You guys, you have to want to change. You've got to have a big enough reason to change. Understand something. I taught myself how to speak Portuguese. I never did any formal lessons. I taught myself how to speak because I have a very high value and reason to speak, because my wife, my children speak Portuguese. So I didn't go to a class, I didn't go to, you know, lessons, private lessons, I taught myself. I had a big enough reason to do it, and if you don't have a big enough reason, if you lose sight of your vision or your purpose, you're gonna be all over the place. So that goes for diet, that goes for dating, for relationships, for your money, like for everything. So you've got to get a big enough vision, and alignment and chiropractic is something that's amazing because what it does is it allows you to get into your body again. It allows you to get connected, and when you're connected, spine and mind, connected with divine, you're feeling fine, but also you actually make better decisions. You're gonna do things that serve you and benefit you and the people around you more. So get aligned and start clarifying the vision. Where am I going? What's my end result? And then work backwards. Great question. Next one.
All right, this is a Twitter question.
Come on.
All right, it says, hello, I have numbness and coldness in my left leg and spasm, sometimes with pain. Did an MRI.
Okay.
The result was back muscle spasm with annular relaxation of the L4-5 and L5-S1 discs. The problem occurs only when I sit or lay on my back. Can you help? I'm from another country.
Yeah, just don't sit and lay on your back. I'm joking, I'm joking. That's what a lot of doctors might say. All right, here's what you've got. So, when the spine is out of alignment and it's stuck, the discs do not have blood vessels. They will shrink and dehydrate and get weaker, and then they're vulnerable to what he called annular relaxation, but which is really like a bulge or a herniation or a protrusion. And so basically, the spine hasn't been taken care of. It hasn't been maintained through specific scientific chiropractic care. The core exercises haven't been adequate to support the spine. And then you injure yourself, and it hurts when I'm sitting, it hurts when I'm laying down. What do? You go to a chiropractor, get your spine checked out, get your spine aligned, start taking care of yourself, because it's only gonna get worse. That's what you do. That is what you do. That's a great question. My man, get on it. Next question.
Right, Maggie BB Squad says, Dear Dr. Jason, I was wondering what I should do if my back is still hurting after I fell off my bed 2 weeks ago.
Snap. Okay. I would definitely go to a chiropractor. I mean, guys, chiropractic care is at the forefront of natural health. We do not add or take anything away from your body. We are looking to see if you're in alignment, because your brain heals your body. Your brain talks to your body, but it can't do that if the path of communication is off. And be careful with that bed, man. Maybe get those guardrails on the side, man. Come on. Okay, next question.
All right, Angel JG19 says, is it bad that I pop my knees, knuckles, back, wrists, neck, and fingers?
Yes, and you know that, otherwise you wouldn't be asking. So get to a chiropractor, because those are all symptoms of you being tight and having stress, maybe even anxiety. You're not in your body. You're feeling like you got to wriggle around and move everything. So get connected, my man. Next question.
The last question I have is from KXNG Society. I've been having really bad back pain and I've tried everything. Can you help me, doc?
Yes, that's why we're here in sunny LA, man. Come on. Look, come in for an evaluation or go see your chiro. If you got a chiro, go see him, definitely. Now I got a question for you. This is from 9.beds. And we had an Instagram story where I had a patient holding a bunch of meds in his hand. And then what I did was I went in and I wrote the names of this is for this, this is this, this is this. This guy takes like 9 meds a day or something like that, or a couple times a day. It's crazy. So he said, what is meant by this? Is this what pills you take if you don't have a chiro? No, it's actually not what I mean. That if you see a chiro, you won't have to take pills. What I mean is this. Here's a guy who did not take care of his health, has not taken care of his body, and as a result, his body's broken down. As a result of that, went to the medical doctor. Medical doctor, to help him, is saying, well, your cholesterol, your this, your that, etc. is out of whack. So take this, take this, take this. That's crisis management. That's actually a good thing. However, with chiropractic, we want to get the spine aligned and reactivate the healing power within. When you activate the healing power, the innate healing power within, I've helped many people get off of their meds, because medicines are designed to be a bridge, not necessarily something you would want to live off of. There's a time and a place for medicine. I'm not a medical doctor, nor do I want to be one. Medicine is a lifesaver, but certain times people get onto medicine and their lives get ruined. It's really tough. So what is meant is chiropractic helps the body to heal from the inside out. And if you're on all those meds, well, you can do your research, but oftentimes you live a deleterious lifestyle. So thank you for the question. Now we're gonna do some Instagram shout-outs and we're gonna get rolling. All right, here we go. We got let's go through this. Thank you guys for being here. All right, Joseph says what's up. Alex says what's up. Joseph, how old am I? I'm 35, my man. Christina, what's happening? JTA Sierno says I'm a big fan. Thank you, my man. Thank you. Appreciate that. Freddie says thanks for fixing my shoulder. Freddie, we were just thinking about you this morning, my man. You're welcome. It's a blessing to serve. Okay. Savage says she wants to come on the stream. Doctor, I sent my resume. All right, my man. I apologize. It's been a busy week, man. We got a lot going on. Jalen Brown says, what's up? World Artists United TV. What's up, Doc? What's up, brother, man? Good to see you. Okay. How do you know if you need to go to a chiropractor? If you have a spine, you want to get checked out. I have back pain. What do I do? I'm only 10, so I don't know what to do. Yo, man, you talk to your parents and you say, hey, got to check out this guy, DrJason, online. He's telling me to get to a chiro. Okay, next. Jada's here. Thank you, Jada, for being here. Emma, we're waving. All right, we're rolling. Do you know Lance? Lance is the homie. We take care of Lance. My goal is to have knowledge like you. Respect, man. I'm on a mission every day to learn, brother. Okay. I am Jay Brady says, what does your typical physical examination consist of before adjusting? Do you assess for neurological deficits, tests such as Hoffman's, Sperling's, Babinski, etc.? Thanks from Chicago. Okay, so Jay Brady, I'm not sure if you're a doctor or a therapist or what have you, but we perform a comprehensive chiropractic exam and, if indicated, an orthopedic and neurological exam, many times visualizing the spine with x-rays. So you got to give me a little more substance on where you're coming from so I understand your question a little bit better. Let's see here. All right, does my spine support my whole body and why? Well, yes, in essence it does, but there's more to it than that. Why? You got to pick up an anatomy book, man. Come on. Okay, good afternoon. Is it true that the neck does not like a sedentary lifestyle? I don't understand your question. I think that our body wants to move. That's how that works. Ben Barkson, what's up, Ben? Thank you for being here. We're almost done. And yes, did I know a lot of people talking about Avicii? Big shout out and respect for a very talented and well-loved man around the world. Gone too soon, guys. You know that a personal belief of mine is that health is wealth. So God bless him and his family. Okay, Dennis says, hey, Dr. Jason, Dennis from the UK, loving the postman and hope everything's going great. Can I just ask if your jacket is available on the website? My man, Dennis, of course it is, brother. We got the outfits. We actually just updated one of our lines. Health is wealth. Go to shop.drjason.com. I've got peeps in the UK sporting the merch, so you can definitely get it. Dennis, make sure you tag me in a photo or a post. We'll get you some followers, man. We'll get you some attention. Okay, PT says, I'm a physiotherapist from North Africa. Love your work and energy. Thank you. Respect and thank you for being here. I appreciate that from my heart. The specific Elk Grove, what's up? One of Sean Dill's crew. All right, let's see here. Let's see here. Come on, come on. Hey, my back has been hurting for a couple of months. I've been to 6 doctors and I can't find anything wrong and I'm 12. If they're medical doctors, they may not, well, they're definitely not looking for subluxation. They're looking for cancer and fracture. So get to a chiropractor. Okay. I'm ordering some of your merch next week. All right, man. Stop sleeping, Ben. Come on, bro. Get on it. Rock that merch, bro. Active Health. Thank you guys for tuning in. Dr. Jason, send me your questions and I got you. I'll get you questions next time. Thank you.